Welcome back to ARC PDX. New data from the Centers of Disease Control show fewer kindergartners are receiving routine childhood vaccinations. It comes as cases of the measles in the United States have surged to record levels. So joining us this morning is Candace DeMatteis, who has served as the Vice President of Policy and Advocacy for the Partnership to Fight Infectious Disease, or PFID for short. Candace, thank you so much for joining us this morning on ARC PDX.
Thank you for having me.
Of course. Okay, so childhood vaccination rates are down right now. Is this a symptom of people just being against vaccines?
Well, there's a lot of false information, candidly, really bad information circulating. And what the trends have shown in the CDC data nationally, but also seen in Oregon, even at a higher degree, is that people, the opting out, there are exemptions from state requirements for vaccines. And what we're seeing is there's a medical side and then there is a non-medical exemption. And what the trends are showing is that there is an increase in non-medical exemptions. And so that's the trend line that we're seeing. So it's declining vaccination rates. The measles epidemic is a great example, and the outbreaks that we're seeing, we're at risk of losing our measles elimination status that we've had for 25 years. So it's really concerning. We're really at a tipping point when it comes to many vaccine preventable diseases.
Yeah, we've definitely seen that uptick here in the Pacific Northwest over the past few years. I know PFID did a study assessing the public's opinion on having FDA-approved vaccines widely available. Can you tell us about the methodology of this study, what it found?
Absolutely. So it was a poll. It was a national poll of people who are likely to vote, because unfortunately we're seeing more and more vaccine policy being discussed and changed at a very high level. But what our polling showed, and this is consistent of other polls that people have done, is that Americans follow the vast majority of people follow their doctor's recommendations and get vaccinated. 74% want us to maintain widely available access to FDA-approved vaccines. And the majority of people also support mandates for childhood vaccines and are concerned about the decline in childhood vaccination rates.
And I understand that people from both sides of the aisle were surveyed here. So how much did those opinions differ between Republicans and Democrats?
It's interesting. So you do see a difference in some of the questions. For example, around mandates, for example, still a majority of people who identify as conservative or Republican still supported mandates, but it was lower than people who identified as Democrats. But it still was the majority of people do support mandates, and the majority are concerned about those declines in childhood vaccination rates. And with these outbreaks, whooping cough as well as measles, we are likely to see those trends continue.
Okay, so what can be done here? Like, especially what can policymakers do, like, to address the misinformation out there and all this public hesitancy?
Well, it's important that policymakers speak with one voice and point to there's a lot of public health authority, there's a lot of information, very valuable information and helpful information, but it's also important that policymakers encourage people to talk to their personal health care provider, to look to authoritative sources, reputable sources. People have questions, and that's perfectly valid, but it's important to point to, again, accurate and reputable sources to help people make those decisions for themselves and their families.
And then as we say goodbye, just really quickly remind us why vaccinations are so important for preventing disease outbreaks.
Well, it's important on two folds. First, it protects you. And then it also, for those who aren't eligible vaccine, those who are vaccinated kind of create a protective barrier. So for really young infants, for example, for older people, for people undergoing cancer treatment who are more vulnerable to these infectious diseases, we are protecting ourselves, but we're also protecting members of our family, members of our community who may not be eligible to be vaccinated or may, for other reasons, be vulnerable to these infectious diseases. So it's protection for yourself, but also for those you care about.
Yeah. Good reminder. Candace DeMatteis, Vice President of Policy and Advocacy for the Partnership to Fight Infectious Disease. Thank you so much for joining us on ArcPDX. It is an important conversation we have to keep having for sure.
Thank you.
Yeah.